Rise up!
They're among the millions of young Canadians who, as of today, are eligible to get vaccinated against the coronavirus.
Thank goodness. They have taken long enough to approve it. I can't wait.
The timing of the approval is critical. Kids under 12 are testing positive more than any other age group. Vaccination reduces their chances of getting sick and infecting others more susceptible to severe illness, a risk that's kept families apart.
I don't have any family in Canada, and my children haven't seen any of their cousins. They haven't seen my grandmother.
Health Canada confirms in a clinical trial, the Pfizer vaccine was over 90% effective at preventing COVID-19 in children between 5 and 11.
The department has determined that the benefits of the vaccine outweigh the potential risks.
Kids could begin getting their shots in just a few days.
Canada will begin receiving doses Sunday, with all the 2.9 million doses received by the end of next week. That's enough doses to offer a first shot to all eligible children in this country.
Now comes the delicate job of persuading parents who are still unsure. In one of Toronto's least vaccinated neighborhoods, public health volunteers encounter questions and hesitation.
They're concerned about if it's kind of painful, or if they get fever or something, or how safe it is.
They're also reminding parents this could help children return to normal.
We're going to have less outbreaks, less school closures or classroom closures, and that will give a bit of stability for kids, because a lot of kids in the past 2 years haven't had it.
The National Advisory Committee on Immunization recommends extending the interval between the 2 pediatric doses to 8 weeks from Pfizer's recommended 3 weeks, which means children wouldn't be fully vaccinated until the new year. Vic Adopia, CBC News, Toronto.
Well, to talk more about this, let's bring in pediatric infectious disease specialist, Dr. Fatima Kakar in Montreal. And Dr. Kakar, this 8-week gap between the first and second doses for children, why is that?
So this is a common question we've had today. So it's important to realize the difference between Health Canada and NACI. So Health Canada looks just at the trial data, which is just what Pfizer submitted, which was this 3-week interval. But NACI's job is to look at their experience with vaccines, immunology in children, and a lot of real-world data. And so based on all of these other data, NACI is making this recommendation because it looks like that longer interval actually provides a longer duration of protection and a stronger duration of protection. And it will minimize the risk of side effects. So potential side effects like myocarditis might be diminished when we have this increased interval. So it's really a safety and really to increase the effectiveness over time.
I'll bet a lot of parents immediately looked at the calendar, did the math, and realized that that means that their kids won't be fully immunized by the Christmas break. Does that concern you?
No, I really think this is a smart decision because we're going to minimize any potential risks of side effects, and kids have a strong, really robust immune response. So I'm really confident that really after this first dose, they will have a strong degree of protection. And I think it's really in the best interest of kids that we have this actual delayed interval.
And there are so many more questions that parents and kids have. And so stick around. We'll come back to you and another pediatric specialist later on in the program. Thanks.
Thank you.